Our first speaker today is Dr. Stanley Monteith. He's an orthopedic surgeon. He's going to speak to us about AIDS. Now, you'll remember, many of you, last year that we had Peter Duesberg speaking. Dr. Monteith is going to speak about essentially the opposite point of view. I thought that it was important for us to hear both sides of this story. We could have, there are of course some big moguls in AIDS research that have a huge financial interest in this issue. Dr. Monteith isn't one of them. He's a principled man. He's fought very hard for the side of the AIDS issue that he believes in. And we're all looking forward, I'm certainly looking forward to hearing his side of this controversy. So, Dr. Monteith.
Well, thank you very much. It's a real pleasure to be here on this with these other speakers. I've been very, very impressed by the quality of speakers that you've had. And this morning, I'm going to present you with a number of facts, which perhaps will be somewhat startling, but you really can't discuss the issue of this epidemic unless you approach it from an overall point of view. It was in the years preceding the Civil War when Abraham Lincoln addressed the Lyceum in Springfield, Illinois. And he asked a question. He said, at what point should we expect the approach of danger? By what means should we fortify ourselves against it? Should we expect some transatlantic giant to step the ocean and crush us with a blow? Never. All the armies of Europe and Africa combined could never take a drink from the Ohio or make a mark on the Blue Ridge, not in 1,000 years. That at what point should danger be expected? My answer, if it ever reaches, it must spring up among us. It can never come from abroad. If destruction be our lot, then we ourselves must be its authors and its finishers. As a nation of free men, we shall live on through all time, or die by suicide. As a nation of free men, we shall live on through all time or die by suicide. And ladies and gentlemen, I'd like to suggest this morning that our nation is dying by suicide from within, but for reasons far different than most people can comprehend. It was shortly after Abraham Lincoln gave that speech that one of America's greatest poets wrote a poem about the crisis that he saw at the time preceding the Civil War, the crisis of slavery. But his words echo to us down over the decades because he speaks of a spiritual battle, and that battle still exists today. And this is what he said. Once to every man and nation comes the moment to decide in that strife of truth with falsehood for the good or evil side. Then it is the brave man chooses while the coward stands aside until the multitudes make virtue of the faith they have denied. Though the cause of evil prospers, yet his truth alone is strong. Though our portion be the scaffold and upon the throne be wrong. Yet that scaffold sways the future, and in the dim unknown standeth God within the shadows, keeping watch above his own. That was James Russell Lowell. And yet there's something eternal that rings from his words. Now, this morning I want to convince you of 6 things. First of all, that contrary to everything you have heard, and certainly in agreement with what Dr. Duesberg has said, there is no AIDS epidemic. He and I would differ, however, as to whether there is an epidemic out there, and I will attempt to convince you that there is an epidemic of biblical proportions which is going to impact, contrary to what you may believe, on every one of your lives in one way or another. Thirdly, that doctors know how to stop this epidemic. Fourth, that there is an organized effort to both confuse you and to block the implementation of those standard and effective public health techniques that are used with all other diseases to stop further spread of this epidemic. That there is a spiritual battle in place here. And lastly, that there's something that each and one of you can, indeed I pray that each and one of you will want to do. Now, when I say there is no epidemic, usually when I'm speaking to a group who's never heard Dr. Peter Duesberg speak, people sort of look a little confused and what are you saying? Well, we all talk about AIDS, but what are we really talking about? As Dr. Duesberg has pointed out so rightly, this is not a disease. There is no disease of AIDS. It's a syndrome, the acquired immune deficiency syndrome. It consists of 30 different diseases. Well, it didn't originally consist of 30 diseases. It originally consisted of perhaps 10 or 12, and then it was modified in 85 and 87 and 93 again, and they keep adding diseases, and some of them are put in for purely political purposes, like invasive cervical carcinoma, because the women said that they weren't getting enough recognition because they had the disease too. And what sort of disease is this when political considerations come in? And then, of course, we're told there's a direct relationship between HIV disease and AIDS, and yet if you have Kaposi sarcoma and you're HIV negative and not necessarily immunosuppressed, you're still considered as being AIDS, and yet you don't have to have HIV disease. And the same thing is true with pneumocystis carinii pneumonia, and it's certainly a definition that does nothing but confuse the entire issue. If you go to Africa and you look at the statistics there, coming out of Africa, AIDS is defined as tuberculosis, chronic wasting disease, fever over a month's period. And the definition of AIDS there, if you actually test the people for HIV disease, you'll find that probably 30% of them are not HIV positive. So what in absurdity are we doing talking about AIDS? And that's a very legitimate question. AIDS statistics, when published, and of course we spend millions, countless millions of dollars at the national and at the state level every year publishing AIDS statistics. Because of the 10-year latency period between infection with the HIV virus, which leads to terminal stage immunodeficiency, and a rather characteristic pattern. Ordinarily, for those of you who are not physicians, our immune system is mediated by two means. One is an antigen-antibody type of mechanism, and the other is cell-mediated immunity. And cell-mediated immunity involves certain T cells, T having to do with thymus or lymph node origin in opposition to B lymphocytes, which come out of the bone marrow. And so the T cells gradually decline over a period of time. The normal T cell count for an individual will be about 900 to 1,000. It can be down 600 or 700. It can be a little higher, but ordinarily it's in 900 to 1,000. And it will decrease, and by the time you get down to less than 200 T cells, you become susceptible to all sorts of what they refer to as opportunistic infections. In other words, your body can't fight off the fungi that may be here in this room, or the pneumocystis carinii organism, which is all over this room, but you with a normal immunity, it doesn't attack you. So this is a specific clinical entity. Infection, and this has been charted by the Army and by all the doctors who deal with this, a gradual decline in T cells. Now, everybody doesn't get the gradual decline, and the decline may not start for some years. We have about an 18-year follow-up on this disease. It was originally described in 1981, but they had blood specimens going back to 1978. So we can figure out what happened to these people over an 18-year period. And 95% of those who are HIV infected have progressed down this gradual slope from 900 to 1,000 on average T4 cells, or they refer to them as CD4 cells, right on down to 200 to 100 to 50 to 2 to 3, and of course eventually death. This is the pattern of the disease. Well, from the time of infection with HIV to the time when you begin to get down to the point where you develop opportunistic infections with a CD4 count of 200 or less, on average is 10 years. Some people will be longer, some people will be shorter. There's 5% of the people after 18 years still haven't progressed to terminal stage disease. So when you read AIDS statistics, what do they tell you? They tell you what happened in the epidemic 10 years ago. So when you read the AIDS statistics and you find that 95% of the cases are in men who have sex with men or in IV drug users, that's absolutely true. And what does it mean? As far as the epidemic in America today, absolutely nothing. So why did they confuse it? Why did they publish these statistics? Well, they can't very well tell you that we're not monitoring the epidemic or trying to stop it. After all, we put out some $40 billion. And if the American people really understood what was going on in the epidemic, they'd rise up in their righteous indignation and would demand that people within public health departments across America and in the Centers for Disease Control be tried for criminal negligence and for unnecessary death. So we publish the AIDS statistics, and you read them, and we talk about AIDS, when the AIDS statistics have no meaning whatsoever. There is no AIDS epidemic. When Ronald Reagan's task force on AIDS finally came out with a report in 1988, they said, we should give up the word AIDS, do away with it, put it into the trash bin of history. It has no significance, it only confuses matters. So what happened? We continued talking about AIDS, because how else can we confuse the American public? Now, contrary, however, to what Dr. Duisberg has told you, there is a major epidemic, and people are dying in America. As of this date, today, between 330 and 340,000 Americans are already dead. 200,000 in the terminal stage disease with a count less than 200, and developing opportunistic infections, and probably almost all of them, unless this new medication, the protease inhibitors, are successful, almost all of those will be dead within 4 years. There are another 600,000 to 1 million people infected across America. We don't know because we're not trying to find out, because we're not testing the general population. The only way you can stop an epidemic is to find out who has the disease, and we do that with every disease, with tuberculosis, with syphilis, gonorrhea, hepatitis, every disease but one. And that is the epidemic, which threatens the very survival of Western civilization. Not because you're going to get this disease, because fortunately it is not very infectious. And I don't mean to tell you that you are going to get this disease. If you're faithful to your partner, the chances of you getting this disease are probably far less than your chances of winning the lottery or getting hit by a meteor. This is a hard disease to get, but it's going to impact on every one of your lives in one way or another. The disease in America is spreading into the heterosexual population, but primarily the black and the Hispanic and the inner city and the poor whites. And in those areas, you will find that, you go, for instance, into San Francisco, where they test every child who's born. Now, every newborn child, they do a routine blood test. It's an anonymous blood test. They don't tell mother if the child has the antibodies, because that's really a means of finding out if mother is infected, not if the child is infected. Only 25% of children with HIV antibodies at birth are themselves infected, but if they have the antibodies, it's maybe 0.02%, something like that. So the epidemic is not spreading into the white middle class at the present time. But you remember in Africa, it's been there for 20 years longer than it's been here in America. And the other thing is that, contrary to what you see on television in Days of Our Lives and all of the soap operas, the average American is not as promiscuous as you are led to believe. And statistics show that the average woman maybe will have at the most 3 sexual partners during her life. I mean, occasionally you'll have somebody very, very promiscuous, but most women are not. Most men don't have more than 3 or 4 sexual partners during their lives. When you get into homosexuality, you may be talking about 1,000 sexual partners a year. And of course, many of those will be multiple sexual contacts, which is why this disease, of course, has decimated the homosexual population. And of course, because the disease can be spread by blood contact, and IV drug users share needles, and the virus is actually within the core, the hollow core of the needle, you spread the disease to IV drug users. In the black population, however, we find the epidemic spreading. We have statistics out of places like Virginia. And in Virginia, about 22% of HIV cases are heterosexually spread. That makes up those that they know are heterosexually spread and those with 2 or more heterosexual contacts. And we get these statistics from the various states where they actually are doing HIV testing. But the tragedy is that almost all of these are in blacks and Hispanics. And of course, this has caused many blacks to feel that we really don't care. I look around this audience, I don't see any blacks today, but I will tell you that ordinarily when I give a talk to a mixed audience, there'll always be somebody in the back of the room who puts up their hands and said, Doctor, I've heard that the white man created this virus because he hates black people. Well, now, that may be pretty unrealistic to you, because I'm sure most of you have no animosity towards black. You care for black people. You deal with them as individuals. But within the black community, there is this feeling, which is one reason why we are heading towards racial strife. Now, let's go to Africa, where this epidemic is being allowed to spread. One of the taped interviews I have with my little cassette set on AIDS is an interview with John Harris, who was sent to Africa by the Josh McDowell Ministry and Campus Crusade for Christ. And he first went into the office of the Minister of Health in Malawi, where he was going to try to introduce an abstinence-based educational program. John has something called Summer Night Communications, and it pushes abstinence among teenagers. And the first thing that the Minister of Health said to him is, "Why do you people in America hate us so much?" And John was a little taken aback. And the minister then went on to point out that in Malawi they have tested. Now, we don't test our high school students or our college students, but in Malawi they do. 30% of their high school students were infected. 68% of the students going to their agricultural college, the elite, the upper intelligence, more capable blacks, 68% were infected. They're almost all going to die. And as he pointed out, we're going to lose a whole generation of our youth. Why are you trying to kill us? Why are you pushing condoms on us when you know that they don't work? Every place we push condoms in Africa, as you tell us, this epidemic is destroying our population. We're going to lose a whole generation of our youth here. Why, in Uganda, they even tested your condoms, and 80% of them wouldn't even pass the water test. You're sending defective condoms. If you go into the tribal area where they stress abstinence, and where every girl, before she's married, is checked regularly by the chief's wife, we have hardly any disease, maybe 3%. And in the cities where we push condoms, 68%. Why is America trying to kill us? In Africa today, half of the men in all of the armies are infected. They don't need a war to kill off the soldiers. Half of them are infected and they're going to die. In Zimbabwe, 60% of the soldiers are infected. You go to the prenatal clinics where they're actually doing testing. In many of these countries, 20-30% of the women are infected. They're all going to die, and the children are going to be born with a disease, and they'll either have no parent or they'll die as well. You go into India today, and you can get the statistics I'm using out of the Harvard AIDS Review for fall of last year. There, of course, you can chart the course of the epidemic by following the truck routes, because the truckers are spreading the disease exactly as we allowed it to happen in Africa. And of course, you would think with a sexually transmitted disease that was almost universally fatal, you'd try to take infected prostitutes off the street if you were trying to stop the epidemic. But of course, we're not really trying to stop the epidemic. In India today, many of the sexually transmitted disease clinics where they test the prostitutes, 50% are infected, 60% are infected, 80% are infected. And you see, back in 1986, 1987, there were only 1 or 2% infected. And we allowed it to get up to where it is, to some places 90% infected, some places 90% of the truck drivers are infected. In the city of Pula, P-U-L-A, 14% of housewives with no identifiable risk factors are now infected, and they're all going to die. The Indian health authorities are talking about 10,000 people a day dying by the turn of the century from this epidemic. And what are we doing? Well, the World Health Organization is insisting that they circulate and distribute condoms, knowing full well that the failure rate from condoms is totally unacceptable. And any suggestion that we push morality or abstinence is actively opposed. In fact, in America today, when my friend John Harris, who I mentioned earlier, goes into a university campus, the Centers for Disease Control, which of course you finance with your tax money, will often call all the local public health officers to go to his meetings to harangue him and attack him for suggesting that abstinence is the solution to this epidemic. There is an epidemic, and of course, how is it going to impact you? Because you're not going to get this disease. Why, of course, the unrest within the black community. Recent polls suggest that 2/3 of the blacks in America either believe, one, that the white man created this virus, or two, that the white man may have created the virus in an effort to kill off the blacks. Now, as absurd as you may think that is not absurd to the blacks, who remember the Tuskegee study where they took 400 black men with syphilis back in the 30s, and they told them they were going to treat them for their syphilis. And then they didn't. They watched it as it eroded away their bodies and their noses and destroyed their minds. Only 125 survived that wonderful experiment carried out in America. Eventually it was discontinued in 1972 when a reporter got wind of it, but the public health officers all went along with it because they wanted to find out what happened to black men who had syphilis untreated. And that was done. Of course, even a Surgeon General, the gentleman who was suggested for Surgeon General, Foster, he was a black man. He knew about it, but he didn't speak out. He just wanted to be accepted by the whites. Do you really think that they would have done that with whites in America? Do you honestly believe that? There is a mentality. It is not here in this community, not in this room, but there is a mentality personified by Margaret Sanger, who formed Planned Parenthood. And if you read Margaret Sanger's writings, she felt that blacks were simple human weeds who should be exterminated along with Southern Europeans and Jews, and she was deeply involved with the occult and with theosophy. And her organization today, the Planned Parenthood, today gets $250 million of your tax money to be used for abortion throughout the world and population control. It is little wonder then that many of our blacks honestly believe that there is this hatred on the part of whites for them. Louis Farrakhan, with his $1 billion he got from Gaddafi, is out there spreading this material. I talked to a woman this last week who told me, she was black, has a radio program, told me that Farrakhan's people are passing out pamphlets all throughout the black community talking about exactly what I'm talking about here today. Creating hatred, hatred, hatred. And that's the underlying thing, the message that they're getting, because you see, they really want to get a race war going in America today. And of course, when we had a strong religious foundation for the blacks in America, when we had strong families. Before we got our civil rights legislation through, despite the fact that there was organized and institutionalized discrimination against blacks, we did not have hatred of black for white. We had a feeling of hurt. We had a feeling of injustice. But despite all of the injustice, the black man never revolted. Today, after 30 years of liberalism and the welfare state, 70% of children born to blacks, women, are illegitimate. There's no father. Between a third and a half of the black young men in America are either in prison, on parole, or on probation. A significant part of the 5 million Americans on prison, parole, or probation are blacks. We are laying the foundation for a race war in America, and that's going to impact on every one of you. And secondly, of course, the financial impact of this epidemic. If you go into Africa, into Zimbabwe, their insurance companies are going bankrupt, their life insurance companies, their health insurance. They had a very sophisticated infrastructure in Zimbabwe, contrary to what you may believe. And that whole thing is beginning to crumble from within. Their healthcare delivery, they can't take care of the people, they just send them home to die. And thirdly, of course, besides the financial impact on each and every one of you, are the diseases that are incubated in the bodies of people with no immunity. Now, when I went through medicine, and I spent 35 years practicing during the golden days of medicine, we had an antibiotic for everything. I mean, it didn't matter what it was. If you got it, we had an antibiotic. We just about did away with infectious disease, but suddenly now you have antibiotic-resistant pneumococcus, antibiotic-resistant staphylococcus and streptococcus and enterococcus and multiple drug-resistant tuberculosis, and much of this is a direct result of people with no immunity, millions of them across the world who are breeding. Every one of them becomes a breeder for diseases that will impact upon you and your children. And suddenly we're having all sorts of new viruses that we've never seen before. We have a flesh-eating bacteria, and the reason you have a flesh-eating bacteria is because you got a streptococcus that's infected with a virus. How it got infected, I don't know. Well, I've practiced medicine for 35 years. I never saw a flesh-eating bacteria. I never even heard of one in my community. And we've had 2 or 3 here in the last year. Ladies and gentlemen, we are laying the foundation for problems that we've never seen before because we are not addressing an epidemic, and we know how to address that epidemic. First of all, I've said that there is no AIDS epidemic. There isn't. It's an HIV epidemic. Secondly, the HIV epidemic is an epidemic of biblical proportions that threatens to depopulate large segments of Africa and Asia. And these people are dying of HIV disease. Because, you see, they test people and then they follow them along and they die. People have always died in Africa. But if you talk to people coming out of Africa today, most of the people there spend most of their time going to funerals. In fact, in Zimbabwe, it said that they just don't have enough coffins. They just bury people in cardboard boxes because there are that many that die. But you see, you're not getting that picture here in America. Because you're supposed to have that warm, fuzzy feeling that everything's fine, we've won the Cold War, but everything's not fine in the world. Doctors know how to stop this epidemic. I led the battle for a decade with an organized medicine in California and realized it didn't matter what doctors wanted. We were not going to carry it out within the last month. The House of Delegates of the American Medical Association passed one of those feel-good resolutions. They came out in favor of mandatory prenatal and neonatal testing. In other words, testing of pregnant women for HIV disease, testing of newborn children. Why? Well, because we can block 2/3 of transmission from infected mothers to their children with AZT therapy, number one. Secondly, if a child is born uninfected and nurses from an infected mother, another 10% of them will pick up the disease, approximately. In a civilized society, we would try to save the lives of innocent unborn and newborn children. But we don't do that in America today. But the AMA came out in favor of getting these laws passed across America. And what happened? Why, the gay activists were demonstrating, they were screaming up at Vancouver when a group of scientists were meeting. They came in and threw red-covered water all over them, suggesting this was infected blood, and the yelling and the screaming and the demonstrations, and the police never do anything. They can do anything they want to. They can come in and disrupt this meeting for an hour, and police wouldn't do anything. After all, they have their civil rights to demonstrate. And you wonder why nothing is done. When they set the federal building in San Francisco on fire here 3 or 4 years ago, nothing was done to them. And they could come in, they go in any place. I've been to the meetings. I don't bother to go to the international conferences at all because they come in and yell and scream and interrupt the speaker. I'll never forget when Prime Minister Brian Mulroney was speaking in Vancouver back in 1989, and they yelled and screamed, and then the public health officer from New York, Dr. Stephen Joseph, got up and spoke, and they were all in unison screaming, and you had to turn the speaker's microphone up so loud so you could even hear him, and nothing was done to retain law and order. And these are the standard techniques. If you read Larry Kramer's writings, Larry Kramer is the man who organized ACT UP, and he said, we've organized this whole system just exactly as Hitler organized the brown shirts. And of course, that's what brought dictatorship to Germany and designed to bring dictatorship to America. Yes, this epidemic is going to touch every single one of your lives. Now, doctors know what needs to be done. First of all, to stop an epidemic, you find out who has the disease. So we have a very effective blood test. We should be doing routine testing for about $500 million, because you can do this blood test very cheaply, as the Army did. For about $500 million, we could test the entire population of America if we wanted to stop the disease. But that is not the agenda. When the blood test was going to become available back in March of 1985, the gay activists went to the government and they said, if you try to use this blood test to test the general population, we will bring a federal injunction against you. So you won't even be able to use this blood test to test the blood supply. And then people are going to die and it's going to be your fault. And the federal officials said, oh, please don't do that. We will not recommend it for general use. And then the gay activists went to every state legislature in America and got special laws passed which required special confidentiality requirements. In California, the doctor faced a $10,000 fine if he even told the nurse in the operating room he was operating on somebody who had HIV disease. He couldn't even tell another doctor that somebody had HIV. We've changed those laws, they're a little bit more sane, but that's the way it was. But we had special counseling requirements. A doctor had to spend 30 to 60 minutes counseling a patient before he even did the blood test, and asked them, women or men, all sorts of questions would embarrass me to even discuss here in a mixed audience. But we were supposed to spend, all this time. When was the last time you went to a doctor and he spent 30 minutes counseling you before you ordered a blood test? You can't do it. And that's what it was all about. We were not to test the general population. Special consent requirements. You had to get a written consent before you could do the blood test. When was the last time you had a blood test in a doctor's office you had to sign a written consent form? Everything was done to block what needed to be done to save human lives. And that's the message you're not getting across America. That's why you don't hear this message from Dan Rather or Oprah or any of the talk show hosts, Donahue when he was still in his prime. Now, maybe he is a god, because Donahue now is off the air, my understanding. Well, routine testing in doctor's offices, routine testing in hospitals. That's the first thing that needs to be done. Not mandatory, but routine testing. Because most people are not going to go into the doctor and say, Doc, would you mind doing an HIV test? Why? Because that suggests that they've done something wrong. On the other hand, if I'm the doctor and I look at you and I say, I think maybe we ought to do an HIV test on you, right? Your first thought is the doctor thinks I've done something wrong, and it puts you into an adversarial position. I tested thousands of patients. I tested everybody I put in the hospital. And I simply said, I'm doing this routinely. And patients would say, gee, doc, I really appreciate, I've been wanting to get a blood test done. Of the 1,000 or more patients that I tested, I think only 2 refused to be tested, and they already knew that they had the disease. But that's how you approach an epidemic, and it should be done all across America, but doctors are frankly afraid to do it. And I refused to counsel. I simply gave them a written sheet of paper, and I said, read it, and if you have any questions, ask me. And that's what President Reagan's AIDS Commission suggested that be done anyway with low-risk people. But you see, that's not the agenda. You can't stop an epidemic till you find out who has the disease, and every barrier has been put in the way from doing it. It's not that the California Medical Association, the AMA, haven't recommended it. It's just the doctors cannot do it because of all the hindrances that have been put in the way. Number 2, the second thing we need is mandatory reportability. In other words, we report syphilis to the public health officer. We report gonorrhea to the public health officer. We report hepatitis B. In California, we report 58 different diseases to the public health officer, and I, as a physician, would face either losing my license or certainly censure if I did not report a disease that was on that list. But in California today, if I were to report the name of somebody with HIV to the public health officer, I face a $10,000 fine, a year in prison, and a lawsuit that could take everything I have. Now, there's something wrong with this picture, unless you understand there's an agenda behind this epidemic. Then, of course, we need mandatory premarital, prenatal, and neonatal testing, and mandatory in this instance because, well, we've had mandatory premarital testing for syphilis for years, because if you're going to marry this sweet little girl and you're going to spend the rest of your life with her, or you are a sweet little girl and you're going to marry this handsome Greek god and you think he's the greatest guy in the world, are you going to say, but, I love you, honey, but would you mind getting a blood test before we get married? I mean, it's just not going to happen. Let's be practical. And how many tragic young people have gotten married and somebody had the virus and they had no idea, and they've gotten the disease and progressed to death, or perhaps they've had children and they've gotten the disease unnecessarily. And we're allowing that to happen because every effort has been made to block what needs to be done and what doctors know needs to be done. And in the California Medical Association, year after year, the doctors would vote to support the positions I took, and year after year, the hierarchy of organized medicine in California would not only refuse to support the position taken by the doctors, which by law they were supposed to, they actively lobby against it. And after a decade, I realized that we're not going to win the battle by playing this game by their rules. Same thing is true with the American Medical Association. There's an organized effort to block any effort to deal with this disease as a disease. Certainly, we ought to be trying to take infected prostitutes off the streets. All across the world, this is a primarily sexually transmitted disease. It would be logical. But when a prostitute who is known to be infected is arrested, you can be sure that the radical left, the American Civil Liberties Union, and all the radical organizations, the revolutionary organizations, will be there saying, oh, you can't do this. This woman's sick. She's got a disease. She's going to die. She needs treatment. You can't put her in jail just because she's spreading a disease that's going to kill people. What about her civil rights? And when you talk about, theoretically, trying to get infected prostitutes off the streets, you say, oh, no. These really aren't prostitutes. These are sex workers. By changing the words, somehow you change what they do. And they really aren't spreading disease, they're educating their customers on means of safe sex. You don't understand. Well, if you look at Africa, I understand, because you can see the pattern of spread of the disease where the prostitutes are servicing the truck drivers. And you look at India, you'll see the same thing. Oh, but in America, we can't take infected prostitutes off the streets. Oh, a few cases there, a few isolated cases, but Kenya probably is the only place that they have any logic and insanity in the entire world. I read the other day in the New York Times that somebody who was in fact spreading this disease was sent to prison for life, and that's where they ought to be. No second chance. We don't allow people who are intentionally killing others to continue spreading the disease, except in America. If you don't know the story of Gaetan Degas, we just want to a break for a moment here. A wonderful book you should read called "And the Band Played On," written by homosexual activist Randy Shilp, but it's a great book and I recommend it to you. Gaetan Degas was the patient zero for the CDC study. He was a homosexual airline pilot who would come into the United States. He was Canadian, but he would come into America for his sexual activity, having about 250 sexual encounters a year. And he was identified through an epidemiological study to be one of the primary vectors for the disease, and they found out that directly or indirectly he had infected 40 people. So they took him down to Atlanta, and they said to him, could you tell us the names of all of your friends and buddies? And he was very cooperative. And so eventually, when they had done their epidemiological study and realized that he had infected, in fact killed 40 people directly or indirectly, they said to him, well, now Mr. Degas, Gaetan, you've got us to stop being promiscuous. And he said, why should I? Somebody gave me the disease, I'm going to give it to others. And knowing that he intended to spread the disease, the officials at your Centers for Disease Control did the only logical thing. They turned him loose. He went to San Francisco, continued to spread the disease. The homosexuals had a lot more good judgment than the public health officers, either in Atlanta or in San Francisco, because the public health officers in San Francisco knew he was spreading a deadly disease too. The homosexuals gave him an offer he couldn't refuse. Get out of town or we'll kill you. Well, he understood that. He moved to Vancouver and continued spreading the disease. You see, we wouldn't do that in a civilized community unless perhaps there was another agenda. Well, certainly we ought to close down sex clubs and gay bathhouses across America, not to stop homosexuality, because you can't do that. Any more than we can stop prostitution. But at least we ought to do the best that we can to get infected prostitutes off the streets, and we ought to test every woman who comes in and let her know that her name is on registry, and if she ever spreads the disease again or is involved in prostitution, that's it. Life in prison, but that's how you'll stop it. But of course, the civil libertarians, the ACLU, some people refer to it as the American Communist Laborers Union, would be there to protect them. And then, of course, we certainly should be doing something about our IV drug users. We have a great debate going on. Should we give out free needles and syringes to IV drug users? Shouldn't we? And on one side they say, this is going to save human lives, because if they use clean needles, there's going to be less of a spread of the disease. And other people say, but you're encouraging IV drug use. And you see, what they have done here, as with so many other issues, is they focus the debate on the wrong issues. Why don't we legalize selling needles and syringes and let them buy them if they want to use them, but we shouldn't be giving them to them for nothing. But you see, we discuss the wrong issues, and so then we keep the emphasis on the wrong things. For instance, for about 7 years, from 1963 to 1986 to 1993, we had people going into the inner city circulating little bottles of 10% bleach to the IV drug users, telling them, if you irrigate out your works with this, it'll kill the virus and it'll be perfectly safe. Now, this continued, and of course, at the same time, they were supposed to tell them that they really ought to get into drug treatment, but they were giving them the sense of security. If you only irrigate out your works with 10% bleach, why, this will protect your lives. Now, would you think that a nation that could send a man to the moon, could send satellites or send rocket ships up to go around Jupiter, that somebody sometime would have taken the time to put a little 10% bleach into a syringe lined with HIV-infected blood to see if it worked? And it wasn't until 1993 that somebody did that and said, oops, it doesn't work. It doesn't work. But if you use bleach right out of the bottle, it will kill the virus, because the reason is, if you take the virus and you put it into a 10% bleach solution, it will, of course, kill it. But if the virus is contained within blood or serum, it is protective and it doesn't kill it. And so, but they don't want to tell the public that, you see, because the only way you'd be really safe in a swimming pool is if it were 100% bleached water, and most people wouldn't want to swim in that, or you'd get awfully pale. Now, I'm not suggesting swimming pools are that dangerous, because we certainly don't have that evidence that the disease is spreading that means. But they keep telling you that the chlorine in the pool will kill the virus, and it really won't. And in our little treatise out here, A Nation Deceived and Betrayed, we simply deal with all the myths that you're being told about the virus, and if they just be honest about it. But then, when was government ever honest with its populace? Well, lastly, and most important, If we wanted to stop this disease, and we've already mentioned routine testing, mandatory reportability, mandatory prenatal testing, getting the infected prostitutes off the streets, dealing with the IV drug users, trying to get them into treatment, giving them money that's necessary to set up treatment programs, and they should be based upon morality rather than on just feel good about yourself, because psychological programs to get patients off of drugs have about a 99% failure, whereas religious-based programs have about an 80% success rate. But what they're doing in our classrooms is, frankly, child abuse. And you heard our lead speaker yesterday, I believe it was Dr. Griffin, talking about what's going on in the classrooms across America. You know, we're worried about our kids watching pornography on internet. And we've got to pass laws to protect our children from pornography on the internet. Look what they're doing in the classrooms. They're bringing in homosexuals to talk about all sorts of deviant sexual behavior. They're teaching kids how to put condoms onto bananas and cucumbers, and bringing in replicas of male sexual organs so that they can understand how it all works together. And all the studies on comprehensive sex education show that wherever you do this, your incidence of pregnancy goes up. And they know it doesn't work. Condom distribution has nothing to do with stopping spread of this disease, nor stopping pregnancy, nor sexually transmitted disease. It has to do with preserving a sexual ethic of hedonism, which is being advocated openly today in our society. And you see it on television, you hear it on radio. It's totally surrounding and immersing our impressionable young people with sex. And we're telling our young people, well, you can't get AIDS from a kiss. And yet, they're talking about kissing on the forehead and kissing on the cheek. The Centers for Disease Control has come out and said deep and passionate kissing spreads this disease. We feel it should not be done, and we feel it has the potential for spreading the disease. And yet they're telling our young people you can't get AIDS from a kiss. They're telling them to use naloxone 9, which is a spermicide, because if you use it, it will prevent getting the disease, where all the clinical studies show it increases the spread of the disease. Now, why do you think they're doing that? And you can get the scientific studies out here. Recently, the CDC has appropriated $300,000 to use with 35 male couples, one infected, the other not, to find out if naloxone 9 used with rectal sex will cut down the spread of the disease. And some people are saying, you know, this is an immoral study, but of course that doesn't bother the people within our government. But we're telling our young people to go ahead and do it, knowing full well that all the studies show it increases the spread of the disease. And so why? It just doesn't make sense, as so much of this that's going on doesn't make sense. Well, I've told you, first of all, that there is no AIDS epidemic. Secondly, that there is an epidemic that's going to impact on every one of you. Third, that we know how to stop the disease. And fourth, there's an organized effort to block the implementation of those effective public health techniques we know will save human lives. First of all, let's talk about some of the various ideas that are circulated. One is a book written by Michael Fomento entitled The Myth of Heterosexual AIDS. And Michael Fomento, and if you read my book, I tell you about my contact with Michael, how he set me up for a demonstration when I testified before the U.S. Civil Rights Commission, and God intervened, and of course the fellow before me got the full brunt of the yelling and screaming and jumping up and down of those young men wearing red armbands of the T-shirts with a picture of Ronald Reagan on the front, only his complexion was green and he had fangs and he looked like Dracula, and they were yelling and screaming. And Michael set that up for me, but fortunately well, the story is in the book. It's not that important. Michael Fomento says there is no heterosexual spread of AIDS. There's no heterosexual spread of epidemic in Africa. It's all because of the use of vaccine needles and because of the tattooing and female circumcision, and this is how they get the disease. He points out, and justifiably so, the epidemic is not broken out as we initially feared within the white heterosexual population of America. He seems to ignore the outbreak within the black and Hispanic heterosexual population. But his book has been popularized all across America, which gives the average heterosexual white person, middle class, saying, gee, I don't have to be involved with this epidemic. His book was written up on almost every conservative Christian publication that I take, and I take most of them. Michael Fomento, The Myth of Heterosexual AIDS. It's not a myth in Africa. It's not a myth in America. We have a much less virulent form of the virus here in America than they have in Africa. Our virus is about 1 1/100th, 1% as infectious as the one in Africa. The only reason it's spread as widely in the homosexuals and the IV drug users is because of the activities, the sexual heroics of the homosexual. Most people would find it very difficult to have 20 sexual experiences in an evening, but not the people who are in this sort of a lifestyle. But it's almost impossible for the average person to understand what goes on, the depravity in the gay bathhouses. Well, then of course there's Dr. Peter Duesberg. And Dr. Duesberg originally supposedly co-authored a book entitled Why We Will Never Win the War on AIDS, and now they've republished a book on inventing the AIDS virus. You've heard Dr. Peter Duesberg. He makes a number of statements. One of them is, this is a harmful passenger virus. It's even grown in T cells in the laboratory. How can anybody say it kills T cells? And who here can differ with him? I mean, how many of you know what happens in the laboratory when they grow the virus? And it is grown in T cells. But it's grown in either, one, T cells that have been infected with the leukemia virus so that they won't die, otherwise they would die. If you put it in with normal T cells, it kills them. Or, as I talked to the head of the CDC virology unit to track the story down, he says, sure, it kills them. We just have to keep feeding in more and more T cells because it's such a lethal virus. But you see, Dr. Duesberg, as a retrovirologist, nominated for the Nobel Prize, why would he tell you something that just wasn't true? He tells you there's no virus in the bloodstream, and yet today, any doctor who treats this will tell you that they measure the progress of the disease and the status of the disease by the number of RNA particles that you get, and about 10,000 is the ordinary number, particles per cc. As the disease becomes more infectious in the later stage of the disease, it goes up to about 1 million viral particles per cc. Why would Dr. Duesberg say something like that? If you read his book, he'll tell you that Kimberly Bergalis, the young lady who supposedly got the disease from a dentist in Florida, was completely healthy. She had a little bout of pneumonia, a little yeast infection in her mouth, and then, or as Brian Ellison says, a little yeast infection like so many women do, inferring it was a vaginal yeast infection. And then they did an HIV test for some unknown reason. They found she was positive. They put her on AZT and she died. Only lasted 2 years. Well, the truth of the matter is, and I have her medical records I got from her dad, Kimberly Bergalis was terminal. She had pneumocystis carinii pneumonia. She had a white count, a CD4 count of 41. Remember, normal is 1,000. You get below 200, you are in danger of getting disease. She had a CD4 count of 41. And then she was put on AZT for a short period of time. It bounced up to 100 and something. She was put on AZT. Her white count went down again. They took her off of AZT. She entered into a clinical study somewhere in Florida where they gave her dual treatment. She was on that for 6 months. She wasn't doing well. They took her off of that. But she did live 2 years. What you have to understand is before we started using AZT, which is a terrible drug, it's like halitosis. It's terrible breath, but it's better than no breath at all, and AZT is the same. It's better than no medicine at all, because before we had AZT and prophylactics, patients would live about 4% of them up to a year. Now they live 2, 3, 4 years with the treatment that we have available. AZT, of course, what you have to understand is the doctor puts the patient on AZT and he monitors CD4 count. Now, of course, he's begun monitoring the virus viremia level in the blood. If the viremia level goes up, AZT is discontinued. If the CD4 count goes down, AZT is discontinued. You watch the CD4 count. They'll tell you that AZT suppresses the bone marrow. That's right, it does suppress the bone marrow. It creates anemia, but T4 cells are not produced in the bone marrow. They're produced in the lymph nodes and in the thymus. And they know that, but they figure that you're too darn dumb to know it. And we could go down all the list of the things. Paul Gann didn't die of the disease of AIDS. He died because he was an old man with pneumonia, but what they never tell you is his CD4 count was 6. I know because I talked to Mrs. Gann about it. Why? They tell you that, people got the disease from transfusions, and a lot of people die after they had transfusions because they were so sick. But why then did their wives get the disease, and the wives sometimes give the disease to their husbands, to their children? They tell you that hemophilia has been good for AIDS has been good for hemophiliacs, because it used to be that the average age of a hemophiliac was 11 years old, and then now it's up to 25. And of course, statistics don't lie, but liars can create statistics. And the real thing is that what's happened to the average age of hemophiliacs, which had gone up to 64, it's dropped down to in the 40s since they had the virus. What happened is that people got the disease from the cryoprecipitate, and they gave it to their wives, and the wives gave it to their children. Healthcare workers working within laboratories with a virus, concentrated virus, cut their fingers on a piece of glass, and they progressed to the disease without AZT or anything else, and they eventually died. They'll tell you no animal has ever gotten the disease. Well, maybe one chimpanzee has gotten the disease, but you see, diseases don't necessarily cross species lines. They tried, they infected, I think, 100 chimpanzees. Only one of them has progressed to terminal stage immunodeficiency. But you can take the HIV-2 virus, which is almost identical to HIV-1, slightly different, and you can put that into monkeys and they get the classic immunodeficiency. In fact, they get it much more readily than human beings, because human beings don't get, with HIV-2, it's usually a longer latency period. So you tell something and you tell it convincingly enough, and then I'm being persecuted for my views and I'm not getting any grants, and I must be telling the truth because why else are they cutting off my funding? And you create a very, very convincing bit of misinformation. And if you want to get into this in more detail, I have a little something I put together called The Lethal Deception, which covers a report out of NIAID in my newsletter, which deals with this. And we are updating this, and if you want a copy of Kimberly Begalis's medical records or some of the other information we put together, you can contact me personally. So why is this going on? Well, Brian Ellison, of course, is another thing. Brian is something else. Brian originally worked with Dr. Duesberg, and he's going all over America saying, my book has been banned. My book has been banned because, and they just don't want the people to know the truth, and that's why they banned my book. And Dr. Monteith is an agent of the CDC, and John Harris, the gentleman who went to Malawi, is paid by the CDC. John thought that was awfully funny because CDC sends public health officers out to give him a bad time at meetings. But Brian has targeted the conservative Christian community of America. His ads have appeared in every major Christian and conservative publication I know. And what's really so interesting is I have written to almost every one of these and offered an article to counteract it. Do you know how many have been published? None. And the question is why? And some of these people I knew very well, that I considered friends, and yet for one reason or another, there is nobody telling the truth that I'm telling you today about this greatest scam of all. Brian Ellison's latest line is that this is all part of the New World Order, people, because what they really want is they want mandatory testing, and then they want mandatory treatment. And they're going to start giving you this toxic drug, and they're going to start killing you, and this is part of their New World Order plan for population control, and that's why I'm telling you that there really is no epidemic out there, and the homosexuals want testing so they can do this. It's just exactly the opposite. Homosexuals don't want testing under any circumstances. The third major force involved in this whole incredible story are the gay activists. The most important thing I can leave you with is there's a difference between being gay and being homosexual. When you become gay, you acknowledge that there's nothing wrong with what you're doing. You come out of the closet and you become part of a political agenda. Homosexuals are people with a same-sex orientation, compulsive sexual behavior in many instances. But whether you like to hear it or not, many of them are responsible conservatives who love this country, and they're very upset about what the gay activists are doing. I know because I read their publications, and you'll see the homosexuals writing in and said, we don't want our organization taken over by the radical left and the revolutionaries. And you must understand the background of the gay movement. The gay liberation movement was formed by a man named Harry Hay, and Harry Hay was a hardline communist, totally dedicated to the world revolution, who left the Communist Party. They knew he was a homosexual, they let him stay in, but he finally decided to leave the Communist Party and organize the gay liberation movement, which, like the liberation movement in Vietnam and in Algeria and in Rhodesia and all across America, was aimed at destroying the existing society. And that's what it was all about. If you remember the Great March in Washington, D.C. in 1993, that was organized by the Communist Party. But what they censored out of all the pictures you saw on CNN and ABC and CBS and NBC along with all the dirty pictures of the naked men prancing around and simulating all sorts of devious sex acts. What they left out was the great banners that said Socialist Revolutionary Party, Communist Workers' Party. Human Events covered this, if any of you want the documentation on it. If you read my book, you will find I simply quote from the communist papers that say this epidemic will touch every life in America. Millions of lives are at stake. Don't allow testing in America. Now, why would that be when they tested everybody in Russia? Russia today has about 1,200 people who are HIV infected. In America, we may have, well, an awful lot, as you heard me say. In Castro's Cuba, they've done what was logical, except they did not need to put the people into quarantine. That was done to solidify the homosexual movement in America. It was an ingenious idea on Fidel Castro's part, you see, because by putting the homosexuals and those infected with the HIV virus in quarantine in Cuba, they were able to implant in the minds of homosexuals all across America the fact that anybody who wanted to do general testing obviously wants to put you into a concentration camp like Fidel Castro has. And Fidel Castro knows exactly what he was doing, because there was no basis for quarantining people with this disease as long as they act responsibly. It's a hard disease to get. But, of course, this was the ultimate revenge, because hundreds and hundreds of thousands of young Americans, men and a few women, had already died in this unnecessary epidemic. And then, of course, you have to understand that behind the American Communist Party, despite what you are been told, and there's certainly the Russian communists hate America and they will do anything they can to destroy us. But there are also people of great wealth in America who've been funding the homosexual movement for a long time. And you can stop by my booth out there and I'll give you a copy of the Wall Street Journal article that points out that the great foundations in America have been funding homosexuality on our college campuses. Homosexual studies, transvestite studies, women's studies, lesbian studies, gay and lesbian studies. Why would the Rockefeller, Ford, and Carnegie Foundations be funding that? Well, I'd suggest you get Professor Quigley's book. Professor Quigley was Bill Clinton's mentor. And in fact, Bill Clinton even mentioned Professor Quigley when he accepted the Democrat nomination for the presidency on July 16, 1992. Professor Quigley wrote a book about America's invisible government. And we don't have time to get into that this morning. But one of the things that he pointed out in that book was that there are many people of great wealth who finance communism, not because they're communists at all, but because they believe in socialism, and the communists want to centralize all power with Washington, D.C., and they want to centralize all power with Washington, D.C., and they're quite willing to use the communist movement to agitate for all power in government. And of course, when we have a dictatorship in America, I don't think it's going to matter whether it's a corporate socialist dictatorship or whether it's a communist dictatorship. We will have lost our freedom, because these movements are intent upon establishing a one-world socialist system. And behind these various movements which are moving towards world government, there are spiritual forces. One of the things, having spent 30-some years studying this and traveled to the great battlefields of Europe, having gone to Oxford University, through the papers of Carroll Quigley at Georgetown, through the papers of the Council on Foreign Relations, gone through Yale, through the papers of Colonel House, one thing was always missing. What's this really all about? And of course, as you begin reading many of the writings of the occultic movements within America, you begin to study the Theosophical movement, you begin to study the origins of the United Nations, you really believe, you come to understand that behind everything that's going on, there are spiritual forces. And if you pick up our reading list, we'll give you references to many books: The New World Order, The Ancient Plan of Secret Societies. What were they? They were occult societies. The Hidden Dangers of the Rainbow by Constance Cumpy, who's researched the occult movements in America for years. If you get some of these books, you'll begin to understand that there are spiritual forces behind what's going on. There is an organized effort all across America to push us towards world government, energized by the New Age. Hillary Clinton recently had a guru in the White House named Jean Houston. She's deeply involved with Theosophy, and most of you don't even know what Theosophy is, but you can't understand anything going on in America today until you understand Theosophy and the significance of Jean Houston in the White House, because Jean Houston is a Luciferian. But don't feel bad. I'm not picking on the Democrats. Nancy Reagan had her regular astrologer who she was contacting on a weekly basis to get advice on how Ronald should be running the country. You look on the back of your dollar bill, you'll see the occult symbol. That was put on the back of your dollar bill, the triangle with the all-seeing eye. Look at it. Understand, this is a Luciferian symbol. Henry Wallace, Vice President of the United States under FDR, got that put on. He was deeply involved with theosophy as well, and unless you understand theosophy, you cannot understand much of what's going on in the world today. We are intentionally allowing the epidemic to spread in Africa. If you have any question about that, we have a brochure out there which will take you at least superficially into population control. I found this difficult to believe, having been in the battle for many years, until I actually went to Elberton, Georgia, and I stood there in the shadow of that great occult monument on the highest hill in Elberton, Georgia, and read engraved in stone the plan of the guides, people who describe themselves as the disciples of the Age of Enlightenment, and read that they really want to get the world population down to 500 million. These statements are repeated over and over again in their writings and their meetings. But of course, most people feel that's incredible. I mean, how could anybody want a population control? The homosexuals are tragic victims in this whole epidemic, and they're dying by the tens, by the thousands, by the hundreds of thousands. And the blacks are dying in Africa, and the Indians are dying in Asia. And all the time we live in the warm, fuzzy confines of utopia, which is really what America is. Each one of you has an obligation to become informed, to become involved, to dedicate yourself in this battle. For as James Russell Lowell wrote almost 150 years ago, once to every man and nation comes the moment to decide. In that strife of truth with falsehood for the good or evil side, then it is the brave man chooses, while the coward stands aside, until the multitudes make virtue of the faith they have denied. Though the cause of evil prospers, yet his truth alone is strong. Though her portion be the scaffold, and upon the throne be wrong. But that scaffold sways the future, for in the dim unknown standeth God within the shadows, keeping watch above his own. Thank you.